to Al-Jazeera's Hani Mahmoud. He joins us from Deir al-Bala. Hani, bring us up to speed with all the latest strikes that Gaza has been experiencing.
Yes, well, we just got confirmed reports of at least 18 people within the past 12 hours have been killed across the central area and the southern part of the Strip. That includes the overnight attacks in northern Gaza on a residential home, but mainly attacks have been concentrating on the Nuseirat refugee camp that's in the northern part of the northern western part of the central area. New waves of attacks on residential homes and public facilities, just not only causing further civilian casualties, but also keep enforcing people into enforced internal displacement. Meanwhile, in the southern part of the Strip, particularly al-Mawasi evacuation zone that's been largely designated by the Israeli military as a safe zone for people to evacuate to, have been relentlessly attacked. And this time we're talking about at least 8 people being killed inside the tents that they built in order to protect and take them shelters, just protect themselves and their children inside these tents. The al-Mawasi is a narrow coastal part of the Gaza Strip, on the western part of the central area, and the southern part of the Strip stretches all the way from Deir al-Bala city all the way to Egyptian Rafah borders, and has been a spot for the hundreds of thousands of displaced families been sheltering since the beginning of this genocidal war. What's going on right now is the more we see of these attacks on the rise, it's just putting more pressure on healthcare facilities across the central area and the southern part of the Strip. We're talking about Nasser Hospital, for example, that has been completely pushed out of service, and right now is trying to get back on track with a few of the insufficient medical staff inside the hospital, as well as all the difficulties and challenges involved in getting the hospital back to on track. But we're talking about one only hospital in the entire city of Khan Younis. The situations are quite similar in the central area. We are here at the courtyard of Al-Aqsa Hospital, the only remaining semi-operational hospital that lacks basically everything that is needed and necessary to save lives. And in order just to get a better picture of what's going on inside the hospital, we've been documenting things for the past months from inside the health facility here. But to get a better idea of how the situations are inside the hospital, we are joined by Dr. Jamal Mar'i. He is a general pediatric a surgeon, as well as Dr. Bushra Uthman, general surgeon from Panzima. That's a part of a medical mission from Australia. Thank you so much for joining us. And maybe a better way to start this conversation is to talk about give us a general assessment of what's going on inside the hospital. Mainly, like, what is the situations with the hospital in Gaza?
My name is Jamal Mar'i. I'm one of the surgeons coming with Panzima from Sydney. Panzima is a Palestinian Australian Medical Doctors Association, and we are coming to help with relieving the teams and help as much as we can. Unfortunately, we were having expectations, but what we saw is well beyond what we expected. Basically, they got a hospital that is helping or servicing 1 million people, supposed to be less than 200 before, and they're not coping. I can't understand how they are going, but they got 5 theaters in the operating theater, 5 rooms, and they said they are theaters, but honestly they are just little cubicles refashioned and done as theaters. There is 0 supplies. Previous medical missions brought their own consumables and supplies to cover them for the couple of weeks they come and relieve through. And we were denied bringing any medical supplies. So we are just depending on whatever left over from other missions or whatever left over in the hospital. And basically whatever disposable, we assume it, we keep reusing, which is not safe at all.
I think we should mention a little bit about some of the injuries that we've been seeing here. I mean, this is a hospital that's stretched beyond its limits, and most of the patients that are being affected are exceptionally young kids and women and children. So, you know, some of the injuries we saw yesterday, shrapnel and blast injuries from explosions, massive chest wounds, esophageal and lung injuries, major abdominal trauma. young kids as young as 18 months old who've been martyred in explosions, severe burns throughout their bodies. None of these patients can go to the intensive care to get appropriate treatment because the hospital is understaffed, undersupplied, and there's just not enough to go around in terms of resources. The teams here are stretched beyond their limits. So these are teams that have been working for over 260 days straight. And we'd highly encourage teams from elsewhere to come and help support the healthcare workers here.
I know this is your first time as part of a medical mission from Australia, and you're probably overwhelmed by what you have seen already, but can you briefly just share with us your experience and how has your work been so far within the past few days?
I think, first of all, the nature of the work in terms of general and trauma surgery doesn't necessarily differ too much from overseas, but the amounts that we're seeing here are beyond imaginable in terms of quantities of numbers. And from a second perspective, I suppose there's a lot of emotional attachment and repercussions to the situations that we're witnessing. So, when you witness young kids who've been martyred from both parents, who have no home to go to, when patients have finished their care, they go back to a tent or they don't have ability to get wound care. These are things that we just wouldn't expect or want to inflict on anyone in any part of the world, and we're just not able to provide the care that they require here today. Yeah.
Dr. Jamal, just given your expertise, I want to know your assessment on what are the major medical needs needed right now.
I would say everything is needed. Staffing-wise, people here were going on for 9 months, understaffed, they're really stressed, emotionally drained, physically drained, they're just coping. And that's staffing-wise. Consumables, theaters, again, we had to operate in difficult situations without electricity. It comes and goes, and when it goes, it's just like for 5-10 minutes. We had to use the mobile torches to continue operating. Of course, if that was a critical moment with bleeding or something, that would be very, very serious for the patients. Overcrowding is a big issue. People has to queue to come to theater. They had to wait like 2 to 3 days just to get their wounds looked at or dressing changed. Medical team-wise, they're just coping. There's no vascular surgeon, there's no neurosurgeon. Spine fixation is a big issue, of course. We're dealing with multi-trauma where people have injuries everywhere. Yesterday we did a laparotomy for a stomach perforation, and he had arm amputation, he had compound fracture of his both legs, and really they need multidisciplinary teams to be able to manage their conditions. Here we don't have any resources. Anybody can, just general surgeons has to cover for everything. Pediatric surgery is a big issue as well. We had a unit with necrotizing enterocolitis. We just managed to operation, but unfortunately she did not survive. She was 1.5 kilos. Really, in big centers they will hardly survive. She didn't survive with us, although we operated, but yeah.
The mortality rates here in intensive care are 100%. So, in any situations, normally we would do these major operations and then be able to provide one-on-one care for these patients. That cannot occur here. These patients are getting extubated and then going to the ward. They're being looked after by family members. There's not enough nurses and staff to help distribute medications. There's not enough medications. There's no supplies to change wounds on the ward. So on a systems and microscopic level, this healthcare system needs huge reform.
Dr. Jamal, Dr. Bushra, thank you so much for your insight. Thank you.
Last comment.
Thank you. So as we heard from both Dr. Jamal and Dr. Bushra, the situations are quite dire inside the hospital. Al-Aqsa Hospital is a representative sample of what's going on of these difficulties, including the insufficient medical staff, the kind of cases that they had to deal with, the acute shortage of medical supplies that making even their work quite difficult, given the lack of resources.
Hani Mahmoud reporting there on the situation inside Al-Aqsa Hospital in Deir al-Bala. Thanks very much, Hani.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.